Let's talk about operations for facial nerve reanimation or facial paralysis surgeries. Basically, there are two kinds of operations. One are operations that just suspend the face in a static way but don't really cause movement. Those are static operations. And the other are surgeries that involve reanimation or trying to restore spontaneous movement. The dynamic operations are many, and the reason there are many of these operations is because as surgeons we've been looking for good operations for many years to restore a spontaneous smile, and I'm sorry to tell you we really don't have great operations for that. They involve, for example, taking a nerve from elsewhere on the body, feeding it from the good side of the face over to the paralyzed side of the face, and then at a later operation adding a muscle to the paralyzed side of the face and hoping everything works well together. And in reality, it usually doesn't. The results are typically disappointing. And it involves a multi-stage process, in other words, many operations. Other operations along these lines are moving a nerve that is already working to try to repurpose it for smiling. So for example, taking a nerve from the tongue and cutting that nerve and then plugging it into the muscles that have been paralyzed that cause facial expression or cause a smile. It also means that even if that nerve works on the smile muscles, the person only smiles when they move their tongue. And unfortunately, we really can't retrain our brains with something like that very well. So these reanimation operations are still not applicable to most people, unfortunately. They usually don't work as well as we hope they would. Let's talk now about static operations. These operations are not perfect either, but the cost of the operation in terms of the length of the surgery, the number of surgeries required, and the morbidity or the pain and the risks of the surgery are much less for these static operations. So static operation means adding basically a puppet string from along where the nasolabial fold is, sometimes inside the cheek, sometimes even the base of the nose on the inside, and bringing those strings up underneath the skin at a deep layer and securing them up to the temple. And each of those little strings can be adjusted so that the tension is just right. Of course, the spontaneous smile isn't there, but for most of the time, the face looks fairly symmetric, and the functional problems that we have with the eyelid being pulled down, with biting on the inside of the cheek, with nasal obstruction because the nose is being pushed on, all of these functional problems that are really bothersome, most of those problems can be significantly improved, if not totally corrected, with static operations.